This video will show you how to log into the Provider Workload Management desktop on LSS. From this screen, you will go in through order entry into your physician desktop through Northern Lancaster County Medical Group onto your physician desktop. By doing this, you will be able to access any of your messages that you have either through the office or the hospital. Some of the screens that you'll see here are incomplete orders. You can capture your incomplete orders there. There will be a section for any new orders that you've created. There will be a section for any admission, discharge, and transfer notifications. And there will also be a section where you can view any results of any patients that are coming either from office procedures or from the hospital. As you utilize this desktop throughout the day, you will be looking at any incoming messages, any results that you receive. The icon here with the starburst shows you that this is a new message to you. In order to view your message, you will double-click in the message, and you will see any test results that are there. In this particular instance, is showing that a tuberculin skin test was done. The result was negative. It shows you the date and the time that it was collected and reported. If there was any messaging information that you would need to send back to the nurse, you could click on the edit button. It will expand your text box, and you could type anything that you needed to relay back to the nurse or to the patient in this text box. Once you save the information, it saves your message, and at that point you would route it to the person that you would need to route it to, either back to your nurse or to a receptionist. There would be categories where under the route to field you could send it back to your nurse, and this way the information will be transferred back to the patient as needed. If you go to the list button at the bottom, it will take you out of that message and it will get you back to your desktop list. If you were finished with this message and you didn't need to route it to anyone else, if you just needed to review this message and you were done with it, you would click Close Task on the bottom. This would close your message. It does automatically take you to the next result, so you need to be careful with that. And then if you go back to the list section, you will notice that that message that you had seen before is now gone because the task was closed.
For those who might give verbal orders or do some inpatient work, if you see incomplete, again, go ahead and double click the item. And in this case, I would acknowledge this document, and that takes me to the next incomplete item. In this case, it's requiring a signature. In order to do that, you go to the right lower corner and click the sign button, and that brings up the two orders that you need to sign. You can open up each item at a time by placing an X in the square and clicking Process X. And say sign. It prompts you for your Meditech PIN, which you type in and hit enter. As you can see, that order is now taken care of. If you wanted to see the order more in depth, you can put the X there, hit Process X, and instead of hitting sign, you would hit the view button. And this will give you all the details of the order in question. But I also want to show you a shortcut. Earlier there were two verbal orders. Sometimes you may have multiple orders. In that case, you can also hit Process All, and that would just sign all of the incomplete orders all at once. Again, it will ask you to sign using your Meditech PIN number. Type that in enter, and now you can see all the deficiencies have been removed.
Under the orders section, you can look and see on this patient it says that it's overdue ambulatory orders. When you click on that, it will show you what lab work was ordered on this patient. In particular, these order dates were January 19th and January 20th. Once it goes past 7 days of your order, if a result is not received for that order, you will receive a task that tells you that these orders are overdue. That way you will know that your patient didn't go to have this blood work done yet, or to prompt you that you haven't received the results of this so that you can have your nurse check into it to see if there was a problem. In order to get rid of this from your overdue ambulatory orders, once you find out what the problem was, you click on Acknowledge at the bottom, and that will take the task away. It does take a few minutes for it to leave, but once your screen is refreshed, then that order will be gone. And you'll notice as we go through these, your categories are being removed. If there is nothing to report in any of those categories, you won't see them. As soon as another order or an incomplete task comes to your screen, those categories will reappear. For the ADT section, this is notification of any admission, discharge, or transfers throughout the hospital. So you will see anytime one of your patients is admitted, if they're transferred from one room to another, you can see that, and you will also see if they're discharged. Again, when you double click on this, it will give you the information of where they are, their bed number, where the old bed number was, the new bed number with the room. And again, you will acknowledge this once you've seen it to take it off of your desktop. Now, since there were more than one item in this list, when you do acknowledge, it will take you to the next item on the list, and you can keep going and acknowledging from there. If you're not ready to view them all, you can click on List, and it will take you back to your list. One of the other sections that will appear here is a Messages section. This is the section where any communication will happen between you and your office staff for any reason, for prescription refills, for any patient questions about test results, or just questions in general. It would appear in a category that said Messages. You would access it the same way by double-clicking. It will take you into the message. It wouldn't have the lab results in it if it was just a message, but you would have a message box here on the bottom. The functionality of this is not working correctly right now. In the message section, you would communicate with your nurse through this message box by clicking on Edit. You can type in any message that you have to go back to the patient. Again, you would save that message. There is a box here to get text. There is a potential to build canned text, and we can put pre-populated information into this. So you can click on here and say OK, and it will put in the information that's already pre-populated. You would save your message in your text box. It will show again in your message section, and you would route it to the proper place, whether it be another provider, a nurse, your receptionist. Those categories would be available to route. If you'll take note, there is a forward button. If you forward a message to anyone, just remember that they cannot act on that message. That is only an FYI. They can view it and acknowledge it. If there's anything that needs to be added, it would need to be routed so that the message could be worked. Again, if it was the last person using this message, the message was totally done, that would be when you would close your task. You do not close your task as you route it to the person, because if you close it, they will not be able to see it. So closed task would be the last person who is acting on this message. Once you route it to a nurse, it will remove it from your message tab, and it will go into the message queue of the person that you routed it to. And in order to get back to your screen, again, you'll go back to List. And that would take you back to your desktop where all of your messages would be.